Carpal tunnel syndrome is a common wrist injury which takes place as a result of the repetitive action of wrist flexion and overuse of the hand and wrist area. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And today I'd like to talk a little bit about a very common condition called carpal tunnel syndrome and its impact on people who suffer from this condition. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So again, carpal tunnel syndrome, essentially what it is, it's a nerve impingement type of condition in which the median nerve, which is one of the peripheral nerves which runs down the arm, the median nerve runs into this tunnel within the wrist area. And what can happen is, as a result of, again, being in a repetitive type position, typically a flex type position of the wrist like this, that tunnel becomes irritated, compressed, and the median nerve then becomes irritated. And again, with this sort of compression, patients will complain about numbness and tingling into the hand area. And typically you'll see this condition with individuals that have some sort of repetitive type of action with the wrist area. So again, it's quite common with for example, people that work on the computer for a long period of time, certain conditions in which there's lots of gripping or grasping, or conditions in which, again, the patient is in a position of consistent wrist flexion. And usually, again, it's something that comes on as sort of an insidious onset over time, again, as a result of this repetitive strain type of injury. So typically with this condition, the first thing that we want to look at is if we're able to get some form of relief with some sort of bracing. So this is a really common sort of initial intervention where a patient will use some sort of a wrist brace in order to, again, prevent this prolonged flexed position. Now, this can be used during the actual work activity if it's symptomatic during that particular activity. For some individuals too, they might actually be getting these symptoms kind of first thing in the morning. And again, this can be a result of sleeping right in this sort of flex type position. So in a similar way that people kind of grind their teeth and they're sort of unconscious with this consistent kind of contracted position, individuals that have carpal tunnel, they can do a similar type of thing in terms of being in this prolonged wrist flexed position. And so depending on when these symptoms occur, somebody might actually wear some form of a brace at nighttime with sleeping in order to prevent that morning numbness and tingling. Other things that can be done, there's specific exercises, nerve flossing exercises they're referred to, or nerve mobilization exercises that can help in terms of freeing up the nerve. And then also soft tissue work and specific exercises to help break up any scar tissue in that particular area, which where there might be adhesions to that median nerve. And again, in order to create more movement right through that median nerve without that impingement taking place. So again, exercises can be helpful. There are also some research that modalities such as therapeutic ultrasound, acupuncture, these type of more passive type of treatments can also be beneficial in conjunction with an active approach as well as bracing, etc. Now, if these interventions, unfortunately, if they don't work for a patient, and again, typically we would go with more of this sort of conservative approach, there's other more aggressive approaches leading to potentially surgery for this condition in order to, again, free up that median nerve. If you have any questions or concerns, or if you're an individual who is suffering from carpal tunnel and you're looking to get some advice and some exercises and some strategies in order to get back to your previous functional activities, feel free to reach out. I'll leave my contact information below. And please check with a physiotherapist to make sure that this or any other information is appropriate for you. Thanks again for watching, and have a great day. Take care.